Hello, everyone. I'm Arundati Muralidharan with the WomenLift Health India Leadership Journey 2024. I'm delighted to share today with you a little bit about my leadership project. The WomenLift Health journey for me coincided with a very pivotal point in my own career journey, in my own professional journey. Along with my co-founder, I set up a think tank last year called Menstrual Health Action for Impact, where we support ecosystem enablers to leverage and use the menstrual health lens to improve girls' and women's health and well-being in low and middle-income countries. As I came into the WomenLift Health journey, I brought questions and thoughts regarding my own leadership style, whether I was a thought leader, and about co-creating and co-leading change. Through my leadership project, I attempted to answer some of these questions for myself while simultaneously bringing attention to a very important, though overlooked issue regarding women's health. Now, menstrual health matters for women at work, and the dominant narrative in India has focused on menstrual leave. But take a moment to think of the woman sugarcane cutter who, some of whom undergo hysterectomies so that they do not miss work due to their periods or other issues such as heavy bleeding. And also take a moment to think about the doctors, nurses, A&Ms, and other frontline workers who bled through their PPEs during the COVID pandemic. This and other interactions led me to think that we really need to think more deeply about the narrative of women's health at work and what this means. Now, but why should menstrual health at work matter? We have over 390 million women in India who menstruate, or people in India who menstruate for about 34 years of their lives, and 215 million plus women in the labor force who will experience a period, yes, at work, for anywhere between 20 to 34 years of their lives. And this matters because we've got slow and steady increase in the number of women who are participating in India's labor force. And we also have women engaged in a diverse set of work, very different work types, workspaces, and workplaces. And their menstrual needs and experience differ as well. And this in turn affects their participation at work, the quality of engagement, their daily wages, income, growth potential, and very importantly, their health and safety. So how do we go about shaping the narrative for menstrual health at work? Now, I spoke with 30 plus experts during my leadership project and to develop a more nuanced understanding of this. And my takeaway is that we need to have a far more nuanced and an evidence-based approach towards improving women's health at work. And this includes first stepping back to look at who a woman worker is. Which sectors are they engaged in? What's the nature of work and work sites? What are the composition and structure of the work sites? Is it male dominated? What kind of women and gender responsive policies and laws do we have? What kind of social cultural determinants affects women, work, as well as their health? And how does age and gender identity play a role in all of this? Second, we also need to hear from women and understand what their menstrual needs and experiences are throughout their menstruating years, right from their young to menopause and beyond. We have basic or essential needs, like we all need a safe, private, clean toilet to change our pads. We have additional needs that may be related to menstrual disorders like PCOS, endometriosis, or the menopause transition. And we all need a supportive environment that is free from stigma and discrimination and doesn't pose any additional risks or hazards. When we're looking at interventions, a single silver bullet like menstrual leave will not cut it for women engaged in diverse kinds of work. We need to be looking at a larger basket of solutions. And this should entail things like essential basket of services or supportive structures, which could include physical infrastructure like having safe private toilets, emergency supplies of menstrual products, safe work environments, and perhaps even labor laws. A good to have would be social support that can come in different ways or look differently in different organizations. Simultaneously, we need to be thinking about our organization policies and larger level or higher level women-oriented policies and laws that have a zero tolerance approach towards discrimination, that may provide flexible work and leave policies, as well as employee benefits. And lastly, we do need more evidence and insights on this issue. And this could include thinking or hearing from women themselves about their experiences, as well as assessments on what really does work to support women, menstrual health for women at work. Now, throughout my leadership journey and throughout this particular project, I've had an opportunity to sit back, to reflect, and to ask myself some of these questions. It's been a journey of self-reflection and self-discovery. It has allowed me to realize that I need to clarify my purpose, to lead with purpose, I need to build meaningful alliances by stepping beyond my familiar and comfort networks. It has allowed me to embrace collaborative leadership by investing in co-creating and co-leading for change. And I am committed to a lifelong process of reflection throughout my leadership journey. Thank you very much.